Again, you have joined North Kansas City's Hospital Healthy Living Series, Cardio for the Heart Patient. Just a few housekeeping notes for you. This presentation is going to be recorded. To ensure a quality program, please remain muted. Questions can be asked at any time, but they will be answered through the Q&A function. Now, I would like to go ahead and introduce Snizhana. I'm pretty sure I did not say that right, but she is with North Kansas City Hospital, and I will have her take it away.
All right, thank you so much. Happy Wednesday, everybody. Thank you so much for joining. So today, let me go ahead and get to my screen so that you can see all that lovely PowerPoint that I have. So today, we are going to talk about cardio for heart patients, how safely exercise. We will talk about practical tips, which you can do to actually feel good, have results, and be safe while you are staying healthy. So I think most of us know that exercise is extremely beneficial for us. We know that we should exercise, but actually not all of us really think how exercise can help my heart. What can it do for me? So let's just briefly kind of talk about that. So first, I want you to think about your heart as muscle, right? So your muscle needs some challenge. It needs some exercise. And when you do some type of movement that is good for you, it actually enhances that cardiovascular system, not just your heart, but your lungs as well. When you think about cholesterol, right, a lot of people think bad cholesterol like LDL and good one HDL. Physical activity can increase your HDL, and you want to have it, well, as high as possibly to protect your heart. Another positive things about cardiovascular exercise is it does bring your triglycerides down, right? So triglycerides actually can contribute to cardiovascular disease. And if you already have cardiovascular disease, you want to protect your heart and keep it as healthy as you possibly can. So exercise actually does a pretty good job to keep your triglycerides quite low. Blood pressure, that's another one, blood pressure and heart rate. So I actually, what I do, I am exercise physiologist for a patient cardiac rehabilitation, and we do check blood pressure for our patients in the beginning of exercise session, during exercise session, and when they're done. And what we see after nice walking on a treadmill or biking or doing some type of weights, their blood pressure will drop, and their blood vessels nice, relaxed, and dilated. And your heart nice and happy. So that's what it does. It actually keeps your blood pressure nice and low. Your medications and your exercise helps with that, and keeps your heart rate in a healthy range as well. Another one, when you actually move in, all those great things happen inside your body, and your cells communicate with each other. As a result, inflammation in your body decreases as well. And if you ever think about your blood sugar, or you check your blood sugar, maybe your physician told you, hey, you need to really step it up and get your blood sugar in healthy range. Exercise can do that for you as well. If you check your blood sugar before movement, and maybe you did 10 to 20 minutes of walking, you will see that your blood sugar actually drops. So it's much lower. And the reason why, because muscles, they actually pick up all this sugary, all that waste, and use it as energy, right? So it makes you feel good. So what I want you to really think about that, exercise is a medicine, right? So it doesn't matter, how much you do, but if you're consistent with your physical activity, you are going to see all those small victories with your health, and keep your heart happy and healthy. So when we really think about what is the best for me? How much exercise should I do? What is safe for me? How much can I push myself? We will talk about today really those practical tips that by the time we are done, you should say, hey, I got it. I think I know exactly where can I start and what I need to do. So one of the things that we will talk about is FIT. FITT. And FIT stands for frequency, which means how often do you engage in exercise during the week. Intensity, so that's very crucial, right? The question is, how hard should I exercise? How much can I push myself? Time, how many minutes can I or should I dedicate to one exercise session? And I think the most important question is, what is the best type of exercise for me? What should I do that I can see results? And just don't waste my time. So when we look at frequency of exercise, there is a couple of good things to remember. So we're looking between 150 to 180 minutes of exercise a week, right? So we will kind of discuss how it's going to look for you. So because sometimes when we look 150, 180 minutes, like, oh my goodness, that's a lot of minutes a week. I don't think I have the time or desire to do as much. But when we break it down during the day and during the week, it's actually possible to accomplish. So it's not going to feel that overwhelming. We do know that if you do about 150 minutes of consistent exercise weekly, you will see great changes, great results in heart health, lung health, blood sugar control, mood control, right? Don't think about exercise just as, physical benefits. We have a lot of great positive, psychological benefits, especially now in times of pandemic. We need as much positive things as we possibly can get. So 150 to 180 minutes a week, and which can equal about 30 minutes most days of the week, right? So, and again, for everybody, it's going to look different. A couple of things I want you to think about. So it's not just about, how much am I exercising during the week? I want you to be consistent. So you want to think about consistency, right? So it's not just doing something for, a couple months and stop for a couple years. So you want to be as consistent as possible. If you feel like 150 minutes to start with is too much, we can scale it down and just kind of over time build that time so that we can get to our beneficial, that type of goal. When patients come to our rehabilitation, that's why we start them about 150 minutes a week. We see them Monday, Wednesday, and Friday, and they exercise about 45 minutes. So it's actually pretty easy to get there pretty fast. So if you do it in the right time and really enjoy what you're doing. So next one, intensity. So intensity is really a crucial aspect for safety. And I think it's the biggest challenge for a lot of people to kind of like, hey, how hard can I push actually myself? So a couple of things. So I will give you multiple different things that you can look at and choose what is the best for you. One of the things that we use it actually in our rehabilitation is perceived exertion. So what it means, we actually ask our patients, how hard are you exercising? That's such a simple question. And while you're moving, you can always ask yourself that question. How hard am I exercising? Is it hard? Can I go faster? Should I slow it down? How does it make me feel? So perceived exertion is basically, how does that make you feel? We do want to create some type of intensity, obviously, to have results and benefit from physical activity, because we do know that if we're not moving and just kind of spending a lot of time maybe sitting down or laying down or whatever it is. So there's not a lot of benefits happening, but we do know that with exercise and intensity, it's going to happen for us. So perceived exertion is something that you want to look at. Next one is pretty simple too. It's a talk test. So while you're exercising and moving, you can ask yourself, hey, can I carry on with conversation, or is it difficult for me? Do I need to catch my breath? So the talk test is a pretty beneficial question 2. Another one is a heart rate monitor. So a lot of smart watches now, they have heart rate to build in your watch, like Fitbit, Apple Watch. So that's something that you can look at. If you don't want to have a watch, you can look at heart monitor that you actually can wear around your chest, and it's pretty accurate. And your phone or your exercise machine can read what heart rate or how hard are you exercising. And another one is we can, in our rehabilitation, we can actually help you to calculate healthy exercise heart rate. And it's going to based on how old you are, what is your resting heart rate, and what medications you are taking. So if you're taking some type of blood pressure medication, specifically beta blockers, it actually going to keep your heart rate more in check, and your blood pressure. So it's going to keep your, heart kind of relaxed, and you are not going to see, extreme high numbers. But I would really advise to talk to your physician or talk to exercise person, like, hey, can you just give me idea what will be my healthy cardiovascular, heart rate for exercise. So that's intensity. So let's talk about time. So we kind of talk about frequency and of exercise, and we said, hey, 150 to 180 minutes a week, but how is it going to happen for me? So when we look at time, I think the biggest challenge is a lot of people think I need, if I don't have 60 minutes, if I don't have an hour, I'm just not going to do that. And that is absolutely not true. So I always tell people, hey, 5 minutes is better than 0 minutes. So we just want to make sure that we find a couple minutes, maybe multiple times a day, so that by the end of the day, by the end of the week, you actually say, hey, I've been pretty active. I am staying pretty active and getting my exercise done. So when we look at time, I will give you again a couple options. So we can do kind of old-fashioned that most people kind of think about exercise, 30, 45 minutes, nonstop of physical activity whenever you choose. Or we can look at breaking it down during the day. So for example, we can do 10 minutes in the morning, maybe I walk inside or bike. Maybe lunchtime, I do some weights, and at night, maybe I do some stretching combination, maybe with some yoga or Tai Chi, or maybe I walk again, right? So we do those 3 times a day, 10 minutes, and guess what? By the time of the day, you have 30 minutes of exercise. You cannot do 10, try to break it down to 5. You can always do 15 and 15. So I actually do this option a lot. I can do, about 20 minutes of exercise in the morning, and during lunch, I will, walk a mile around the hospital. That's about 15 minutes, and I'm done. So it's pretty easy. Just kind of look at your schedule and see where you can fit that, a couple minutes there and here, so that you can have all the benefits. It actually does not matter if you do, 3 times a day by 10, 5 minutes, or you do something nonstop for 30, 45 minutes. It just kind of, depends how busy you are and what you want to accomplish. Type. So type is kind of tricky. When people ask, hey, what is the best exercise for us? And people, walking, swimming, biking. But reality is the best type is what you like, right? So you need to really sit down and think about it. Hey, what do I like? If you don't know what you like, think about what you strongly not disliking. So maybe start just, what I actually can do and don't hate every single minute of it. So when you think about type of exercise, a couple of things to keep in mind. Like I said, think about what you like. Second, you want to think about how functional it is. Is it going to help me during my, everyday activity? So think about, large muscle groups, walking. Maybe you have stairs at home. That can be an exercise too, going upstairs, downstairs. Another one, do you have knee pain, back pain, hip pain? So all those things will come in consideration with choice of type of exercise you're going to do. And I want you to think about cardiovascular exercise, and I want you to think about resistance training or strength training exercise, which will involve some type of weights or body weight, nothing complicated. Very easy. So, but combination between cardiovascular and strength training, will give you pretty good, solid, exercise program. So again, we just finished talk about frequency, intensity, time, and type of exercise. I hope it's kind of pretty simple. So I want you to think about, what are you doing now, or where can you start, and kind of thinking about what you like or don't like, and how hard can you, start doing that. Couple things with guidelines for exercise safety. I think I already mentioned before that it's always good to talk to your physician, right, and ask for advice. Another great option is talk to exercise physiologist. You can always stop and talk to me in the hospital. I can definitely guide you with that. Any exercise person, maybe, in the hospital, fitness center, or something like that, that you can definitely ask for advice and different type of ideas. Respect your current level. Think about where you are, right? How active you are. So we want, gently increase intensity and duration, and start nice and slow, that we do not, overwhelm your system, and we don't burn out because maybe we do too much or push too hard. I always remind my patients, how do you feel when you're done? You should feel awesome, right? By the time you're done with your exercise, you should feel like a rock star. And next day you should feel good. And actually you should look forward to movement. So if you're feeling, hey, I have new aches and new pains and something that I really don't like, probably it's not the best option. So we need kind of revisit that and maybe pull back. But I want you to be kind of mindful about it. I want you to be safe, and I want you to find something that, you can maintain for a long time. Another thing that a lot of people forget, that exercise actually includes warm up and cool down. Please don't skip it, right? And when you think about safety, what warm up does, it increases your blood flow to your lungs and your heart, to your muscles. It actually helps you with your breathing. It's much easier to carry on with your exercise when you have a proper warm-up. I always say 5 minutes warm-up, so nice and easy. For example, let's say you walk outside, right? If you're walking outside, start nice and easy, nice and slow walking for 5 to 7 minutes. And when you feel like, okay, I think I'm warm, I can, increase my speed. Cool down. I don't want you to just abruptly stop your exercise and carry on with your day. I want you kind of do same what you did during warm up and gently cool down. It can be the same activity, just slow. It can be some type of easy stretching. That's what we do in our rehabilitation. We actually stretch and cool down that way. Another aspect with exercise is, are you paying attention to your breathing technique? So a breath is crucial. Actually, good breathing pattern will increase your stamina and endurance. When you think about, hey, I just want to feel better, I just want to help, to increase my stamina. Breathing is a good way to start during exercise. So what is the right, or I guess, best beneficial way for us to breathe? So when you think about breathing, I want you to think about breathing through your nose. Right? So we have nose, we have mouth. So first step, like, hey, how am I breathing to begin with? Do I keep my mouth open? Is it closed? Do I breathe into my nose? Do I breathe too fast? Is it a choppy breathing? So I think just analyzing your breath during activity is crucial, right? So if you have asthma or any type of lung condition, you're probably more aware of the way how you're breathing. So if you're not, probably not so much. But a good exercise breathing technique is breathing into your nose, out through your nose, or breathing into your nose, out through your mouth. So what I want you to remember is always breathe into your nose. Always breathe into your nose. So try to keep your mouth shut and breathe into your nose as much as you possibly. Don't overbreathe. Don't make yourself dizzy, maybe concentrating too much, but really paying attention to your breathing technique during physical activity is going to be very beneficial for you. And last one with exercise safety is take a rest, right? Schedule that day when you just have, and I call it active rest, right? So it may be just walk slow outside with your dog, or just maybe do yoga, or maybe just don't do anything, right? So maybe cleaning your house, right? That can be exercise too. So schedule some rest so that you actually do not burn out and looking forward to your next session. So another one that I really want to kind of, that you guys pay attention is when to stop exercising, right? If you had cardiovascular event, you probably know for sure how it felt. So if you feel any type of discomfort or pain or similar feelings that you had before, you had some type of trouble, I definitely advise you to stop and call your physician and consult about it. Extreme breathlessness, when you really cannot catch up your breath, right? So not just, hey, I cannot breathe because I'm exercising hard. There is something unusual, right? So that comes down to control your breathing. But if it's more than that, definitely I would advise you to stop and again talk to your physician. And some people can actually feel rapid heartbeat. Some people can feel irregular heartbeat. So if it's something that is unusual for you and something that is new and have not been discussed with your physician, I would probably bring this to your physician attention as well. Okay. And the last one, I think I talked to you about, you need to do this and you can do that. But the question is, I want to enjoy it. I really don't, I don't want to treat it as, oh my gosh, something else I have to do that I don't have time, or I don't have motivation, or I don't feel safe, or I don't know what to do. So we want to kind of know how to enjoy our exercise routine. So if you already, found this 30, 10, whatever minutes you had, you don't want to be miserable. You want to enjoy that. And number one, and I think I already mentioned that, is establish a fun exercise routine. Really think about what do you like, right? Try different things. And that way comes different help online. So especially now with pandemic in 2020, and we're in 2021 now, there's a lot of things online that you can look at and don't spend any money. So think YouTube, right? So we know that if we have any questions, we can always YouTube. It comes down to exercise. The only advice with YouTube, with exercise YouTube, make sure that it's a reliable source, right? So just kind of look who is that person, what are they offering, kind of scroll down and see what type of exercise. Is it to your level? Is it too difficult? Because again, it's online, so they really don't take responsibility for your health. You just kind of want to research that. If you have silver sneaker, so you can do silver sneaker. Some of you probably do have it and know exactly what I'm talking about. They have silver sneaker on demand. You don't even have physically to go to fitness center. It's completely free. You can look at fitness apps. So that's actually what I do now with my exercise. I have a couple fitness apps for yoga and different type of exercises, and so I just do that at my home safely and really enjoy it. And I feel like I'm a part of the class. Change your routine, right? Find different things. Maybe you don't like too much walking. Maybe you can do walking, some type of biking, maybe some, when it's get warmer, we can do some type of swimming in the pool, weights. And I would kind of talking about get a workout body, right? Right now with pandemic, like, oh my, Snizhana, you can't find a body. I mean, we all kind of trying to keep, each other distance and stay at home, but you can definitely, it doesn't have to be this person physically present with you. It can be online, it can be over the phone. Maybe you have children or somebody that you're close to in another state and do exactly the same routine and just kind of keep each other accountable for that. And last one, what are the obstacles, in the past did you have? What stopped you from exercising? Is it time? Are you stressed and you kind of don't pay attention to what you do health-wise anymore? You don't know what to do. You have new aches and pains. So I think that working with the obstacles would definitely kind of set you up for success and help you to actually be consistent and doing all those fields that we talk about: frequency, intensity, time, and type of exercise. Okay. And I am done. So if you guys have any questions for me, I am open to answer.
That was absolutely great. Thank you so much. Okay, let's see if we have any questions.
I always say, if there's no questions, I'm sorry, I probably did pretty okay job that people got it.
You did a very, very good job.
If you're not asking me, or you didn't listen at all and you don't know what to ask, or it was pretty okay and you kind of, okay, I think I got what she was talking about. Sorry, no, that's just.
No, I think you did phenomenal. I do have a question. When working with patients who are just starting an exercise program, what is the number one concern that you hear?
Intensity. How much can I push myself? How much can I do?
Okay.
That's probably, and I see a lot that we have family that love us so much and they are concerned and they want to protect us and then don't let us do anything at all. So I think that really get comfortable talking to your physician, talking to us. How much can you push yourself? Monitor safety to get you mentally to the place where you feel like, hey, I can do it.
Perfect. And now I will ask you, since we had talked about this a little bit before, what are the options for people right now besides home that have had a cardiac event?
So I work for outpatient cardiac and pulmonary rehabilitation. So if you had event in 2020 or 2021, so you can actually come to us and do 36 sessions. It's supervised exercise program, which is safe. We also actually reopening a maintenance program where you can come back to our program and participate in exercise program, just carry on. And North Kansas City Hospital has a lot of options, maybe not as many options as we used to have, but I think we as a hospital doing phenomenal job, to offer people things, like we talk with you about, yoga classes. Just get that comfortable, safe, supervised place where you can do that. So just be curious, research, call us so that we can answer those questions and get you on the right track.
Perfect. I have one more question for you. So, as far as starting back to working out, or maybe people who have been working out, what is your opinion on a heart rate monitor or heart rate monitor devices?
I think it's excellent to have. I think it's a great investment to invest and get something like that. So it just comes down to accuracy, right? So we want to know, like, what are we looking at really? I know I have, smartphone, and sometimes it does read accurate, sometimes it's not. So you just need to be aware. So if you're kind of looking at your heart rate through the watch, the most accurate, what we've seen is a heart monitor that you wear on your chest. So it's a Polar heart monitor. I don't know if I can say name or not. I'm not paid by Polar, so I'm just going to tell you that. So you just put it on your chest, and it actually does a pretty accurate job looking at your heart rate and looking at your EKG and transferring that to your phone or to exercise machine that you're exercising on, so you can see your heart rate. And with heart rate, we need to know your age. And basically it's, I can tell you, if you guys can write it down, it's 220 minus your age, and you need to know your resting heart rate. Resting heart rate is when you're sitting down and no exertion, or ideally when you wake up and you're nice and relaxed, that will be your resting heart rate. So you will subtract your resting heart rate and multiply by 80% of exercise, or 60, and you will add that resting heart rate back up. Sounds complicated, but it's actually not. So you can, I would probably, if you really need to know exactly number, I would ask your physician to do that for you, or exercise person. Any exercise person can definitely do that. I have not seen it online. I don't know if you can really punch that online, but you, again, just keep in mind, if you are taking blood pressure medication, it's not going to be accurate. So you would actually take in consideration medication doing their job and keeping your blood pressure and heart rate low.
Perfect.
So,
Okay. Well, I'm not seeing any other questions. I think you did an amazing job. Thank you so much for
thank you so
presenting
much,
for
guys.
us.
Stay safe, stay warm. It's a little cold outside. I don't know if it's a little, but a lot cold. And just join in for hospital community talks as much as you can.
Thank you guys. Have a good day.